Face masks are an effective way to prevent COVID-19, and it's important to wear them the right way. Dr. Richard Chaffoo joins us now to explain. Dr. Chaffoo, good morning. Good to see you.
Good morning, Shally. Good to see you too.
We went from just a few months ago being told, don't wear masks. You don't need a mask. It's not going to help you with anything, to now being told to wear some type of facial covering. What was the change?
Well, it's just like anything else in medicine, Shally. What we needed was data and information. And clearly we could see that, many people who actually get exposed to COVID-19 are relatively asymptomatic. In other words, they don't have a fever, they don't have a dry cough, they don't have systemic symptoms. And unfortunately, because they're asymptomatic, they're the ones that tend to spread the disease more readily because they're not going to go see a physician and certainly not going to be hospitalized. So the concept is that this disease is spread very easily by many often asymptomatic people. And so by wearing a face mask, we're certainly protecting our community at large and also ourselves.
Yeah, so you're just reducing the risk. Like all these little things, you add the social distancing, you add the face covering, all of it adds up. I saw somebody post on social media, Dr. Chaffoo, that said, well, this isn't going to keep me from getting COVID, but it is to protect other people from yourself.
Yes, because remember, of course, like you said earlier, we are a community. So not only are we responsible for ourselves, but let's be responsible for those other members and just be good citizens and take care of one another. I think this is the thing, coming together as Americans. We've always done in times of national crisis. We've always risen to whatever occasion it was, whether it was a world war or 9/11. This is another serious issue that we're dealing with this time.
We're going to talk about some tips about things that you should think about when you put these face coverings on. They don't need to be masks. And I'm looking at this list because I know one of the reasons why there was even a concern with these face coverings is you don't want to create some type of contamination. If you don't do this correctly, it could be a problem. And I have seen the things that you are about to talk about right now, the way people are wearing these face coverings.
All the time, Shally. It's unfortunate. And I see this as a physician. I'm out there obviously thinking about this. Would you like me to bring my son in, Matthew, and we'll give you a little example of how to put a face mask on? So Matthew, come sit over here next to me.
Hi, Matthew.
So this is Shally. This is Matthew.
Hi, Matthew.
And so basically, Shally, the masks that I'm going to show, there are different masks. A different size out. Obviously, masks, a smaller mask for a child. And the important things about these masks is, like you said, you want the mask to fit properly. So what are we looking for? What are the tips that we want to look for? Well, first of all, when we place these masks on, and Matthew's got this long hair because, of course, nobody's been going to the barber, right? So we want to make sure that the mask, tilt your head up, Matthew, thank you. We want to make sure that mask covers the chin properly. We want to make sure, by the same token, that it covers the nose completely. We don't want to see it where, the tip, I've seen this where people aren't wearing the mask over the nose or just over the tip. It needs to come way up on the bridge of the nose. Also, we want to make sure that that mask fits firmly and snugly in all areas. We don't want it to be loose fitting anywhere and fitting underneath the chin as well. And then we want to be very careful, Shally, that with the mask that we're not constantly taking it on or off, and we're not touching the mask with our hands. Those are the main take-home features for these masks.
The one that I think gets me every time, Dr. Chaffoo, is I've been seeing this recently a lot at the supermarkets, and went to a fast food place. The mask is sitting below the nose, like it's up on the lip. I'm like, what's the point? What are you doing?
Right. I've seen that a lot too. And so the key is you want to, because remember, the virus enters our respiratory system either through our nose or through our mouth. So we really have to cover and protect both of those areas, not just one or the other.
Can it go through your eyes?
I guess there's always that possibility, but the studies at least seem to show that most of it's really going through our nose and through our mouth as we touch our face somewhere, and the virus can travel into those areas.
I drove by. Yeah, okay, good to know. I drove by a fabric store and there was a line out the door, the way people were looking for toilet paper. Which, by the way, I see it all over the stores right now. It's back.
Yeah, me too.
People are now looking for fabric to be able to get creative with these masks. So are there fabrics that are better than others, or you just want any type of facial covering?
Shally, that's a great point. You want to have basically a material, something like maybe a 600 weave, something really tight, and then you want it folded over on itself. So it could be a pillowcase, material made of a pillowcase, could be a flannel pajama. But the big key, Shally, is you want to do a light test. In other words, if you're unsure if that's an adequate mask, hold it up against the light. If you're seeing a lot of light through it, if you're seeing your computer screen or the screen of your phone through this, then it's not thick enough.
Okay.
Because it's not going to filter out about, which it will, if it's thick enough, filter out about 60% of particulate matter. Now, the surgical mask will filter out a little bit more than that, but they're only really needed for healthcare professionals. Something that is a tight weave that you can't see light through is really the take-home message for people. Then you're wearing a mask that's safe for you and safe for other people.
Yeah, and make sure you take it off properly, like your little Matthew, where you
Exactly.
take it off and then like wash the cloth ones. You just throw in the washing machine.
Yes. Exactly. You just take it off like this. You
Okay.
don't touch the outside surface of it, and then you obviously would put that in the washing machine to wash that.
Okay, thank you, Matthew. By the way, that was fantastic mask model. Men are more likely, what we're finding out, than women to die of the coronavirus. So scientists are thinking that they can treat them with female sex hormones. What is this? Is
Yeah,
this
so it's
for
a
real?
fascinating, the Chinese were the first to identify that men not only got a more serious form of this disease, Shally, in other words, more often end up in the ICU, but are also ventilated, and than women. But they thought initially, well, in China, more men tend to smoke than women, so they thought that may be a factor. However, then that was the same thing that the Italians found, other Europeans found, and we've also found here in the United States. So we don't feel that the hormones are the entire picture because, men, in addition to tending to smoke more often, are probably not as good at washing their hands as women. So it's a more complex issue. But what we have seen is that the hormones estrogen and progesterone may actually have a protective effect in reducing the severity of this disease. And so there are some studies that are ongoing on the East Coast and the West Coast looking at that.
It'll be interesting to find out if that works. Dr.
Yes,
Chaffoo,
definitely.
good to see you.
Good to see you, Shally. Be well.
You as well.